So we have already looked at those indicators. Um, Let me make the connection between those indicators and surveillance. Currently in the country, we still lack robust data management systems, what you can call health information management system. Uh, we have a fragmented system, a fragmented system where most of these entities are implementing their own data management systems. So these NGOs are doing their own things, governments may also be doing their own things. So you can go to certain health facilities and you don't really find coherent data, very good data. Different organizations may be using different forms to collect data. So there is need to have a unified system or a standardized system for collecting data about health and reproductive health in particular. So what usually happens is that you may be having a conflict somewhere or a volatile situation somewhere. There's disruption of lives, and then you have internally displaced people, and then NGOs come to respond. And in one of the areas of responding is reproductive health. So what they do is they carry out assessments. So these assessments are what you can call baseline assessments using some of the indicators that we have talked about. Okay? And then based on that assessment, then they can now implement their interventions according to the need and what people are saying in the community. So if we had a very robust surveillance system, it could be very easy for us to be anywhere within the country and be able to know, for example, the different indicators, maternal mortality, the need for the unmet need for family planning, prevalence of the different STIs, including also HIV, GBV, and things like that. But if you look for that data about South Sudan, you'll get what I earlier on described as fragmented data sets. The data sets that are not comprehensive enough. So every entity collects its own data and then uses its own data to do whatever they want to do. So that's why a standardized system is very important. So if you have a surveillance system in place, you have a unified, standardized way that is systematic in collecting data, analyzing it and interpreting it, and therefore knowing what the trends are over time. So this is very key in identifying the emerging reproductive health issues. Okay, are we having an increase in STIs amongst people of these characteristics? What is happening where and when and why? Data can help you answer those questions. Okay, and then also if we implement interventions, reproductive health interventions, we can be in position to know if the interventions are effective or not based on the data that we have. So it is very important to have a reproductive health surveillance system because it allows us to know what is happening in the population in terms of reproductive health indicators. That is, what problems are happening where, when, and who is being affected, and what are the trends. What interventions are being implemented, and are the interventions effective or not? So if you have a reproductive health surveillance system, these questions can be answered. So what are the key things of the reproductive health surveillance system? Of course, You need to have data being collected continuously, whether electronically or even using our paper-based. And then you have the appropriate indicators, and the data being entered is actually correct and valid or even reliable. Validity and reliability are very important. Like we have looked through the different indicators. If a child of 1 year dies, and then that one is entered as a neonatal death, then that is wrong. Because a neonatal death is the death of a child who is below 28 days. A child who is 1 year, it is an infant. Okay? So, if we don't have the correct tools, data collection tools, and the correct definitions for each of these, such that even you have the right people who have the competences to enter these data, you will still most likely get wrong data. So after collecting data, you need to do the right data analysis, and then report this data, like that it can be disseminated and people can make informed decisions based on the data collected. So that is basically the key components of the surveillance system. You need to have the right tools like data collection, data analysis, and reporting. Okay, it's very important. So a robust surveillance system should have the following qualities. One is timeliness. This is to do with the ability to even report or detect any change in real time. Real time, this is to say that if in a month of September there was an increase in the number of STIs, we should be able to see that. We should be able to detect that in real time. So during September, we are able to detect that there was that. But if, for example, we collect data about STIs in September, but we come to a conclusion that there was an increase in the number of STIs or the cases of STI, and that increase is being detected in November, yet it occurred in September, then you have a problem with that system. So real time is, yes, there is an increase now, and we should be able to see that increase, or we should be able to detect it and be able to respond. If it takes time for you to detect an increase, then you don't have a good surveillance system. Point number 2 is about representativeness. Okay? Where are you collecting this data? Or what the samples? The samples. If you're going to say that the prevalence of HIV in South Sudan is, let us say, 2.5, where did you collect that data from? Is it from all the states? And if it is from all the states, the numbers from each of the states, are they representative of the state? If the answer is no, then that data is not representative. So for you to make inference, which is basically that we cannot test for a particular health condition in everyone within that given population, but we can get an appropriate sample. So that sample should be representative, or what we say adequate. Okay? So for us to say that there is this increase, that means that we should have had sufficient samples to reach that conclusion. Sensitivity is another property, which is that the system should be sensitive enough to detect changes in reproductive health indicators and trends. You can have slight changes in reproductive health indicators, and that slight change should actually be detected. If you need a greater change any a reproductive health indicator, for you to detect that change, then you have a problem with that system. Then number 4 is what we call flexibility. Okay, the ability of the surveillance system to adapt to changes, reproductive health priorities and needs. If there is need to twist some of the reproductive health indicators, how easy is it? If it is difficult, then the system is not flexible. The data that you collect about reproductive health indicators should meet the needs for privacy, confidentiality, and issues to do with ethics. Okay, shouldn't be collecting data that reveals the health status of given individuals. So that is an issue to do with privacy and ethics. And then we have what we call interoperationality. Okay, this is very important. In the health system, we have very many organizations working and even collecting data. If you only have this system being used by government agencies and the NGOs cannot use the system, then you have an issue. Or when the private sector cannot use the system, then you have an issue. So the issue should easily be used by other people whom you may wish to have authorized the access or even to use. So the ability to share and exchange data within different agencies is very key. If an NGO wants this data, you should easily access it with the appropriate authorizations. The same with other entities. If it is difficult, then that is not good. Even within the government, different government agencies may be interested in health data. So different agencies should find it easy to share and exchange this data among themselves. And then we have an issue to do with the reliability. Okay, the system should be robust enough to allow for continuous data collection and reporting. Okay, it should not be one that can easily break down and you lose a lot of data and you don't have backup systems in place. That's a very big problem. And then accessibility. If you want to have access to this data, how easily can you access this data? That is another aspect. So we have to look at the types of reproductive health surveillance. You can have what we call active surveillance, where you have dedicated personnel and systems to actively collect reproductive health data from different sources. Okay, so you have an infrastructure, a human and infrastructure resources to collect data about reproductive health in a given location. That is what we call active surveillance. Okay, this is very suitable for rare or severe reproductive health outcomes. Okay, so if you have a very big problem and you really want to address it, one of the key things you need to do is to have an active surveillance team for that reproductive health problem. Okay, sometimes you have this problem not being detected, so that's why you may need to have an active surveillance system. Now, passive surveillance is when in health facilities you have an interaction with the physician or nurses or whatever health personnel that you have, and then they detect that you actually have particular condition, for example. And then they take note of that and then communicate to the relevant authorities about the condition that you have. So those conditions that are reportable, that can be not that can be reported to the health authorities at the different levels are the ones we call the notifiable diseases. Okay, so it is not an active process where you say we are going to continuously be recording data about this, but in your usual way of doing things, you find a person with a particular condition that you can actually report. Okay, so we have in developing countries especially, maternal deaths are supposed to be reported. Okay, maternal deaths are supposed to be reported to the public health authorities. But we also have conditions such as Ebola, suspected cases of Ebola, and other conditions that are also notifiable. Okay, so the health facilities report data that they collect to the public health authorities, and this is part of what you call the passive surveillance system. And then we have what you call the sentinel surveillance system. This is where you go and carry out data collection in a particular facility to understand the specific reproductive health problems or behaviors in that particular location. So it is not an entire survey. Okay, we just focus on specific localities or sites, and then get data and then analyze it and understand what health problems are affecting the chosen population. These usually can be vulnerable populations that are at risk of having, or they actually have poor reproductive health outcomes. And then you can have what we can call special surveillance systems. Okay, this is where there is a specific reproductive health issue that you want to really understand. Sometimes you can have emerging reproductive health issues that you basically have hypotheses about, but you want to collect more data to really understand what the problem is. So, for example, when Zika virus was common in Brazil and the other South American countries, there was an association between having a child born with microcephaly and then being born by a woman who is affected by Zika. So, of course, by that time, the linkage between the two was not known. So, for that linkage to be, or that association to be understood, there was need to collect more data to understand the association between a pregnant woman affected by Zika virus and the chances of them having a child with microcephaly. So you need to collect data to have this. So that type of surveillance is what you can call tailored surveillance systems. They are special surveillance systems to address a special reproductive health problem. So you need to draw the distinction between surveillance and a survey. When you talk about a survey, you're basically interested in going into the population and collect data about a particular problem at a particular point in time. Okay, so after collecting your data, you go back and do analysis, and that's all. whereas surveillance is a continuous process. It's over time. Okay, so surveillance is a continuous ongoing process where you do data collection and interpret and make the rightful choices in terms of decisions to make. We have what we call cluster investigation in reproductive epidemiology. Okay, you can have a cluster of just being basically a geographical area or a geographical area where the individuals within that area have unusually high number of a particular reproductive health problem compared to what has always been expected. So you may need to do an investigation to understand what really is happening. Okay, so of course you start by having a surveillance system in place. The surveillance system is that which will alert whether there is a change in the patterns. So that change will result into a detection. And there is a problem here. And then you move to the next step of confirming if indeed the problem exists. Okay, this is when now perhaps you can do laboratory tests and other investigations. Okay, and then come up with a hypothesis, which I earlier on explained is that you come up with a possible explanation or a statement that links an exposure with a particular health outcome. And then you carry out further investigations to test if indeed there is this association. After that, then you can now institute the appropriate measures and then see if the methods are actually working. Okay. Generally, to do with the data systems or surveillance systems, the challenges that we have in the context of South Sudan are related to, of course, that system has not been implemented across all the health facilities, either because of logistical issues. Sometimes you don't have the qualified personnel to do this data management issues. You don't have, of course, issues to do with network issues to do with the national grid. When we talk about the national grid, we talk about issues to do with power, electricity. Most of our facilities are relying on generators and solar panels and things like that. So being on the power grid also affects, because this system is electronic, it requires computers. These computers need to be powered. Okay, so we have that. And then also the conflicts. The conflicts make people to run away from their localities, sometimes leaving the health facilities empty. What you can call ghost health facilities. You have an infrastructure in place, but there are no health workers and health services are not being offered. Okay, and then the other issue is that you have a lot of partners that are actually implementing different systems to collect data. So we have a lot of data issues that are affecting the surveillance systems in the country. So there is need to actually improve the things. Okay, so that marks the end of our presentation. We can now go and rest.